in my talk mainly about the roles and responsibilities, the challenges this job has, and as well as some benefits and cons of the job as well. I'll try to mention, and then in the end, I will share some learning points as well. So a bit of my background, I graduated from King Edward, but in my final year, I came for a elective in King's College, London as well. And after that, I did house job, and I straight away came to UK, and I did my core training. And then I went out of training for a couple of years in stroke medicine. And then I started my higher specialty training in 2020, and I'm nearly finished now. So it's very important to choose the specialty which fits your personality as well. I would say that always start with the end in mind, like that how your life would look like after becoming a consultant. And I had the luxury to speak to people who were near their retirement and even in their retirement to see how they see their medical profession and career, and it really helped me to think more pragmatically. And of course, you should know your strengths and weaknesses. If you like hands-on experience, then do the specialty which offers you that. And if you don't like it, then choose accordingly. So the roles of a medical registrar are mainly to lead a big medical team, and it can involve that either you're working on a front door and responsible for all the acute admissions, as well as at the back door in the wards, trying to support your junior colleagues. And of course, if patient is very sick and they're deteriorating, then you go yourself and hands-on. You have to deal with the complex case as well. And in all this job, you have to talk a lot with a lot of specialities on front door with ED colleagues. They could be very challenging conversations as well, and with other specialities, including surgical and medical, and as well as with the ITU if patient is deteriorating and requires level 2 or level 3 care. And you would be required to do a lot of critical decision making, in particular if for example, in ALS scenario, in cardiac arrest scenario, you have to really act up and take those decisions very quickly. Okay, so the challenges could be like, it's a lot of people, whenever I speak to some colleague, they always say, so busy, so busy. But of course, it's your perception how you take this challenge as well. And then you plan your own call accordingly. It could be busy, especially out of hours and the weekends, because mostly around the uncertainty what you would get from this job. And then the challenges could be clinical as well as non-clinical as well, which could be pressure of work or multiple patients getting unwell at the same time. And non-clinical challenges could be again some staffing challenges, and with again communication gaps and trying to resolve some conflicts between the wider healthcare professionals. It could be nurses, and between doctors as well, and between various cadres as well in the NHS. And it's a fast-paced system, and if you walk through from one part of the hospital and you reach to the other end, you would see a lot of people, and there would be a lot of emotions being thrown at you as well. So you have to really acknowledge and understand that you don't need to respond to each and everything. You got to have a clear mindset. Okay, so pros could be you really develop yourself as a leader. You do manage small to medium teams, and at some points larger teams as well, depending on the size of the hospital. So you can polish your skills as you go along in the training. And of course, it gives you a broader clinical exposure, working for different specialities. It could not be your main specialty, but you learn a lot from them and speaking to those specialties, and you can take that knowledge and develop your own clinical acumen. This is where I slightly rate UK training above the USA training, where you have more broader exposure before you land as a consultant, and it gives you a very good, strong foundation, I would say. And personally, you develop yourself in various aspects, not just in clinical aspects, but there could be other aspects as a teacher, as a leader, as a mentor as well, and it could be very rewarding for you. Um, and if you have one good day, despite being busy on call, you could still be feeling very good when you're walking back towards home. Okay, so the disadvantages could be if you don't plan very well, or it depends on your personality, you can still work on it. It could be stressful. There is a risk of burnout, especially if you do not take appropriate breaks, you don't plan out your rota very well, or if you are not looking after your sleep patterns, your health as well, and you end up tidying up a lot of mess from the day team, especially if you are working out of hours. Some things are sometimes deliberately left over, and medical registrar has to deal with it. But as you go along in your training, you can deal with them quite confidently. Okay, so in the last minute of my presentation, I would give you a few tips that you really need to have a good positive mindset to work through your training, and of course, you would be, it will give you those lessons which you can follow in your future professional role, and be very proactive. In even from the start of the day, if you start very lazy, your day would be you will feel that you are tired and exhausted mentally and physically. So do first thing first. For example, if you have to say, if your job is to eat a frog, so eat the frog in the morning, and if you have to eat two, eat the big one first in the morning. So this is how you can do the most busiest thing or most challenging thing first thing in the morning, and then you can be relaxed and do the rest of the work in your own pace, and understand the importance of delegation of the work, and do not keep everything to yourself, and have a good work-life balance, and try to set clear boundaries that this is work, this is my own personal life, and try not to overlap. A lot of people do that. No matter which level you're working, it is really so important. Try not to check your emails at 6 o'clock when you wake up or when you're going back home, and that's how you can really enjoy your personal life as well. And of course, manage your schedule not just on daily basis, but it's important to manage on weekly basis, and if you're better, then you can even very easily plan on yearly basis. That's how you can relieve a lot of your own personal anxieties around the work stress. So that would be, I think, my last slide. Thank you very much for having me.